Governor, today
Yes.
we hit over 4,000 COVID cases for the first time, the highest single-day record. Especially over the past few days, we've seen cases going up, hospitalizations. What can you say about potential restrictions that are going to be put into place? We hit this peak back in July, and now we're seeing cases even worse with so much more open. What can you tell North Carolinians who want to know about what you're doing to keep those numbers down low?
We are deeply concerned about the number of cases that North Carolina is experiencing. We still have not seen the spike that a lot of other states have seen, but we know that the potential is there. We're particularly concerned about the percentage positive of cases that's creeping up, although it has not gotten into double digits yet. We will do what we need to do in order to protect the health and safety of North Carolinians. I do know that with the current safeguards that are in place, with mask mandate, social distancing recommendations, occupancy restrictions, and the mass gathering limits, that all of those, if we could get people to comply, that we could push down these numbers, and that's been our effort over the last several weeks to try to get people to comply. But we're going to analyze all of the potential additional steps that we could take, and we know the order expires December the 4th, but it's possible that we might do something before that time.
I'm just looking short term because I know Thanksgiving is next week. When you look at the next week until Thanksgiving, do you envision you having to come out and tighten restrictions?
We will do what we need to do if the science and data tells us that we need to do that. And I'm going to say again, because we said it time and again, please make sure your Thanksgiving plans are safer and smaller, because we are finding that this is a place where community spread is occurring in a significant way with informal social family gatherings. And we all want to see each other during the holiday, but we really are in a position where we can turn the corner on this pandemic as soon as these vaccines are beginning to be distributed. And let's don't give up now when we do have people who are getting sick and dying. We can slow this spread to get across the bridge until the vaccine is here. And I know North Carolinians can do this.
On election night, you spoke of the politicization of the virus and the need to get past that. Have you seen that happen at all? If not, why not? What needs to happen to get there?
Well, first, we aren't having all of the political rallies where thousands of people are gathering together. I fear we may be seeing some of the remnants of that with numbers that we are seeing here and across the country. But I believe as we're beginning this process of change of administration, I believe that things are going to get better. I think things have gotten better in that a number of states have seen such a bad situation that they've had to reimpose restrictions. And a lot of people, although there's controversy, a lot of people are accepting that because they are seeing hospitals strained and people dying. So I think it's going to continue to get better, and particularly when we change administrations and there is a more coherent federal strategy, I think that will be positive not only for North Carolina but the country.
When you talk about the possible need to step back on some of these restrictions, how important is it to have some help from the federal government if and when you need to do that as governor from an economic standpoint?
Well, the more voices that we can have that are encouraging people to wear masks and socially distance and abide by these safeguards, the better off that we'll be. And if we have a strong federal voice telling us that, then it's important. I am concerned because we don't have another federal package. We need the funding desperately right now. I mean, we have been helping small businesses through our MER program. We opened it up to restaurants that are really struggling. We see that the demand is there. We see that the demand is there for our people who are on the edge and can't pay rent and can't pay for utilities, and our HOPE program is helping them. But all of that money is going to run out very soon, and as a matter of fact, under federal law, it has to be spent by December 30th. So if there's nothing to replenish it, then we have a significant problem on our hands. And so we're continuing to encourage the congressional delegation and the president to come together, to put partisanship aside, and to let's pass a package to help us get through this bridge time until we can get this vaccine distributed and implemented in the population.
To put this question to the business owners who have had a really tough year, I'm thinking gyms and theaters and salons, as you weigh decisions that you might have to make, some tough decisions, what is your message to some of these businesses that might be impacted yet again? Gyms that are going to have to close, maybe.
Well, first, we haven't made decisions about going backward in our safeguards, but we know that this pandemic has affected disproportionately businesses that gather people indoors. And that's just simply because that is where the virus thrives and where people become most infected. And so health officials and scientists have had to tailor our safeguards in those areas to try to slow the spread of the virus. We want to continue to provide as much help as we possibly can to them. We want them to help us carry the message that our economy will be stronger and people will be healthier if they wear a mask and socially distant, and we can get our economy back going again. But we're going to continue to fight for federal funding. A lot of them got some help with PPP. We were able to provide additional funding, but a lot of these businesses are at the end of their rope. Some of them have already gone under, and we need to provide as much temporary help for them as we possibly can until we can get around the bend on this pandemic.
I know you just mentioned before talking about the percent positive rate, which is yesterday I think it came in at 9.2%. You said we're not quite at 10% yet. If we did hit 10%, does that signal a different phase or an elevated level of concern?
Well, today it's 7.9, and we try to look at a week to 2 week averages of percent positive, just like we do with cases. We want it to be 5% or below. There's some states that are way up in the high teens, and we don't want to be there. We know that we need to do a lot more testing, but the percent positive is really the number that tells us a lot about where we are, and it's why we use that as one of the critical numbers in our county alert system. It's still going to be a combination of metrics that we're going to look at in order to make decisions.
And I think we need to call last question. Does anyone have a question about our visit today?
Did you have any more questions?
I wanted to ask about,
Yeah, I just have one more after him, if that's okay. Go ahead.
That's fine.
go for it.
I just wanted to ask you, we today at 12 o'clock broke news of this company, Apoject. I don't know if you can speak about this, but there's a development that's going up in RTP where they're going to be manufacturing, COVID-19 vaccines. This is a huge $795 million facility. What do you know about Apoject? And also, is this going to help in getting a COVID-19 vaccine to North Carolinians?
We've been in contact with this company. We're very excited and are hopeful that not only will it create a lot of good-paying jobs for North Carolinians, but it'll help with protecting people from COVID-19 here in North Carolina and across the world, to be able to have everything that you need right there to be able to inject the vaccine into a person. Obviously, they've already gotten federal funding for this, very promising. I'm not sure they've gotten full federal approval yet. They may or not have, but we're very excited about it and very hopeful. And I think I issued a statement about that today, Dory, that you can get to them on that.
And why do you think they chose RTP? They're just a couple of miles down the road.
Well, first, we've become a hub for biotech, health sciences, and we are a place that the world looks to help to manufacture life-saving medicines, run clinical trials, do research. It's a combination of our great universities, community colleges, our biotechnology center, and people know that they can get a good workforce here. So we're continuing to work to get this opportunity in crisis and to create better paying jobs. And we've got a long road ahead where we can position ourselves to get people retrained and educated to make sure they get some of these better paying jobs to tackle our post-pandemic economic recovery.
When we talk about the restrictions, returning to that topic, if and when you have to take things back a step, how hard is it to kind of put the genie back in the bottle, but even as like a society?
So I think people are tired and frustrated, but we are going to continue to urge people to do what they need to do to get us across this bridge to the vaccine and save lives and to keep the economy going during that time. I think it's harder because people have been through it for almost 9 months now. But at the same time, we know a lot more about this virus, and we might be able to be more effective in the steps that we take. And pulling everybody together to encourage compliance, I think, is one of the most important things we've done. For example, when we started this thing in March, we didn't close down businesses like Brightview and others that were manufacturing and were doing things that we needed to do to keep people employed. And we knew that they could install the safety measures to protect employees. There's some businesses that rely on entertainment and people gathered together indoors that makes that a lot harder. So we're going to work with our business community. We're going to work with local leaders and try to determine the best way forward.
Does it make you nervous to have to even think about telling business owners that they might have to close again?
We'll do
Just
it.
as governor, they're looking at you very closely and
Sure.
does it
We'll-
worry you?
We'll do what we need to do to protect the health and safety of North Carolinians. We've done that in the past. We'll do that in the future.
And I think we need to end there.
Thank you, guys.
Governor,
Appreciate
thank
it.
you so much.
All right, guys.
Appreciate you.
Take care.